About geriatric medicine. I think you all know, I think some introduction about geriatrics, and you all had grandparents at your home, and you all be experienced and gone through what are the medications they are taking, how you have to take care of them, and who is the caretaker, how they are monitoring them, what are the medications, how to give a diet food and everything, right? So the definition of a geriatric medicine, the medicine which usually medicines which we are giving for the older persons will be very less doses, as much as less we are giving, and we are, most of the times we'll try to give through normal, like we are trying to give less dosage as well as less medicines. So here there is no much medicines. I'm not discussing about medicines. I'll be telling how to take care of them, what are the monitoring parameters, and when you have to go for the checkup, and which drugs should be avoided. Okay, so the definition of geriatrics is a medicine which deals with problems and diseases of old age and the medical care and treatment of aging people. So geriatrics, which means we are dealing with their diseases and the problems which we are going to cure through medicines as much as possible. And the classification of geriatrics is, we have a newborn will be up to 3 months old, we call it up to these 3 months old, we call it as newborn. Infant will be 3 to 12 months, and toddler will be 1 to 5 years old, and kids will call the age is 5 to 13, and for adulthood will be 20 to 39 years, and middle adult will be 40 to 59 years, and the old age is 60, the above 65 called the old age. And what are the symptoms we see, like once they get old, what are the symptoms and what are the changes we can see through them, like and the food intake, and they accept what are the medications you will give. They'll refuse, right?
If you change the brand, they will refuse.
Yeah, they'll ask 100 questions. You bought some other medicines
Last time.
Yeah. And the common problems, the symptoms are atypical presentations and multiple pathologies we can see. Like what are the common problems we are seeing? Falls, like they'll not be having much immunity and and immobility and incontinence, like they'll not be under the urinary voiding, they'll not under their control. And the pressure source, they'll keep sleeping, like they'll not be able to move. If here at 50 age itself we can feel this, like we feel so much of restlessness and all, right? So there'll be, and the confusion may sometimes be caused with the drugs as well as the disease what they're experiencing. Sometimes depends on the environment and family issues, economic, everything will matters. And constipation and painful joints, the joint pain we can feel it now also, they'll be having more than us, I feel so. And breathlessness, dizziness, anemia, infection and fluid imbalance, electrolyte imbalances, and peptic ulcer, stroke, depression, dementia and visual impairment, like will be 80% of the elders will be having, right? And next I'll come for the physical examination, how to examine them. Like if you are a healthcare professional at your home, like what are the primary things you can do for them? Physical examination.
Monitor side effects of medicine, like if any.
Check for cataract. Yeah, you can actually see, in that.
Cataract you'll see at home.
No, it's like a way, so you can find out easily. Like it will work in time.
Yeah. General examination, we have to check their edema, pedal edema, and whether they're having any disturbances. They'll complain now what the disturbances if they're having that, and you can also examine what are the problems they are feeling it. And first thing we'll go for general examination. Consciousness will check. Are they conscious, alert, what we are saying, are they replying or not? And next is pallor. You all know what is pallor. And then pedal edema, hydration, skin texture. Of course, it will. Yeah, elasticity will. Yeah, and then orcus sensilis, which is the white matter and the gray matter ring will be deposited with the fat. So we can see that because of that only we will be having vision impairment. And then what is next? So bed sores and leukoplakia, which is those who are smoker or non-smoker, they'll get the white color patchy thing near the lips, right? It is a sign of a cancer, like they are going to. Yeah, if it is older also they'll get, and some those who are they are smoker, they also will get it. And then dentures. Of course, dentures that will fix now the tooth, which is if they had. Yeah. And then next is vital signs. We'll check for the temperature, and then respiration, how they are breathing, are they feeling any difficulty. So all this we can examine at home itself, right? And then
Less or normal, comparative to the elder patient, temperature will be low or normal?
it will be normal. And next, systemic examination. We can also examine if they complain anything about heart, chest pain, anything. So will even if we are doctors also will not be having any ECG machines or anything to do at home, right? So we have to rush to the hospital. Like as said in workshop, Sandeep Sasa was saying, if you have, even if you are expert also, you cannot do anything regarding heart. So you have to take to the hospital. And then gastrointestinal system, like constipation and enlarged prostate, if for men. And then next for now, what?
This is under the physical examination?
Not physical, like if they are feeling any difficulty to pass urine, so you can as how much of the knowledge you have, you can educate them, right? Like how to maintain cleanliness and what are the medications you have to take for that. Yeah. And nervous system, like orientation, behavior, cognition, speech, memory, and then vision, and as well as hearing also. Next come for the aging. Aging is a major impact in the elderly patients. So mainly skin elasticity will losing because of that dehydration. So elasticity will they'll be losing. And there is a next after the skin, let's come for the hair, the depigmentation we can see the gray hair. And next come for muscular system. Muscular system is like muscular system is like the number of anterior horn cells which is aging, and so which is muscular weakness we can see through them, correct? Yeah. And then we can also identify smell as well as taste, are they identifying or not, as if any response they are getting. And then joint pain, of course we'll get it at 35 years itself, but they'll be having more. And we also can give a treatment for that. If they get arthritis, we can also suggest them to take for a cortisone injection. It will be given once in a year. You cannot take every year, like they should take once in every year, but once after a 5 years they should not continue with the same, like they'll get more pain over that. Yeah. And then next come for immune function. Immune function is like aging, poor nutrition, and chronic ill health in many old people. So for that, which is including because of the low immunity, there will be a more chances of getting infections. So we have, as much as possible, we have to prevent that. And next is when who is taking care of them, we should also tell them to give up medications properly, and they should not miss the dose. And at least 2 months once they should go for a health checkup, like from head to toe they should keep checking, even if if they don't have any disease or anything, but they should keep monitoring it. and if they are on any medications, we should check what are the medications they are taking. We have to write it in a block letters, like these medications at this time you have to take, and this is the frequency. And polypharmacy will be the major risk in the elderly patient, so we should avoid that. And next come for the drugs part. So the major drugs are affecting in geriatric patients are sedatives and hypnotics, which is causing an confusion states, falls, and urinary incontinence. Sedatives, of course, they'll cause sleepy everything, so they may fall, and urinary incontinence, while they're sleeping, the bladder will not be under their control. So we should try to avoid at the daytime. We should not give, and we should make them to walk as much as, and they should walk with any of the caretakers. We should not send them alone. And next, and there should be a good environment for them. And next is antiemetics and neuroleptics, which will cause Parkinson's syndrome and confusion and postural hypotension also. And next is diuretics. Diuretics will cause electrolyte imbalance. And next, dehydration. So next, NSAIDs will cause upper GI bleeding and cardiac failure and dyspepsia. Anticholinergics and antidepressants will cause confusion and urinary retention, constipation, and dry mouth. Next, I'll be disorders presenting with atypical features. This is myocardial infarction. This is presenting with confusion, weakness. If they are complaining any of the fatigue, breathlessness, and palpitation, chest pain, so we have to seek for that. And then bronchospasm, confusion, rapid respiration, and minimal chest signs, like they'll be getting any pain, or they'll complain like they're having gastritis, but it is not a gastritis. And then appendicitis, confusion, constipation, and diarrhea. And next come peptic ulcer. Peptic ulcer also will be anemia and hematemesis and melena without previous symptoms like dyspepsia. And next is UTI, confusion, urinary incontinence, and what is that? Increased frequency. Next is dysuria. The dehydration. Dehydration, like no thirst and skin changes will be there. Of course, in elder patients we can see their skin changes, right? So because of the dehydration. And hypothyroidism, lethargy, and yeah, I didn't write that. Thyrotoxicosis, which is a weight loss and cardiac sign like atrial arrhythmia and excess of sweating and heat intolerance. And most probably the elderly patients they'll be always under the, like, they'll be maintain the normal temperature, but there will be more chances of getting stroke because of this heat intolerance. And then diabetes mellitus, the complications like nephropathy, retinopathy, neuropathy. And what are the medications they're taking for neuropathy? We have to monitor it. So this is a major impact on elderly patients. And brain tumor also may cause. Next is risk factors for a fall with rehabilitation measures. What are the risk factors will be we can see with the medications. Like first, they'll be having reduced visual capacity. Of course, in elderly patients, visual capacity will be very low. So we have to go for a cataract or safety measures at home itself we can take. And then reduced hearing, we can use hearing aids, and we have to remove the wax and keep cleaning their ears. And next, vestibular dysfunction, the drugs which are verapamil, nimodipine and nitrendipine. And dementia is like from zolpidem. So we have to treat for the with the proper medications, and this zolpidem is causing the major impact on that. And next is preoperative dysfunctions, like we have to keep monitoring vitamin B12 levels, and the normal range of vitamin B12 is 160 pg per ml. I don't know pg, what is it? And then the preoperative dysfunctions, like when they go for exercise, they should not do much more exercise, like how much they'll do, like for 30 minutes they should monitor with the same time and the same frequency. They should not, like one day they'll do more and one day they'll decrease, one day they'll not be in their mood, so they should not do that. What the time they'll fix, they should do that. And while they're walking, they should wear the proper footwear, and there should be good environment. And you have to keep checking their BP as well as postural hypotension, the major risk. Well, like when they're sleeping, we feel that they are sleeping, but we should not neglect, like when they're lying or when they're sitting, we have to check the BP. Of course they'll refuse, but at least in 2 days once we have to check. And then sedatives also will cause slow and steady walk. When they go for walk, we should not take any of these medications. And then antihypertensives, and they keep checking the BP, like they'll tell, for example, like doctor will tell you have to take daily this medication. So once the BP suddenly it will decrease, they feel of course hypotensive and they'll feel dizzy or anything. So if they go for walking, if they are going for walking alone, so of course if they had any falling history, so it will be a major impact on them. So to keep check the BP and then have to give the medications. And then yeah, major barriers what we can see, either you can see in hospital, or if you are like if you are standing in at least example for bus stand, if you're going for any function, and then you can educate them, right, like where you find them, if they're having any problem with that, at least you can educate what are the things you know, you can educate them. And this, I think that's it.